If your ankles look like they're hiding balloons under your skin, I need you to stop what you're doing and listen carefully. What I'm about to share helped my 72-year-old patient walk without pain in just 2 days using something you probably already have in your fridge. I see this every single day in my practice. Patients come to me frustrated because their favorite shoes don't fit anymore. They can't wear their wedding ring because their fingers are too swollen. And the worst part is, many have been told by other doctors that this is just a normal part of aging, and there's nothing they can do except take water pills. But I'm here to tell you something different. I'm going to share a simple kitchen remedy that has helped many of my patients find real relief from water retention. It's not a magic pill or expensive supplement. It's something so simple that when I first tell people, they look at me like I'm joking. But then they try it, and they come back 2 weeks later showing me their ankles, practically dancing in my waiting room. Now, before we go further, let me be clear. What I'm sharing is educational information, not medical advice for your specific situation. If you have swelling that comes on suddenly, especially if it's only in one leg, you need to see a doctor right away. That could be a blood clot, and that's a medical emergency. If you have heart problems, kidney disease, liver issues, or you're on medication, you must talk to your doctor before trying anything new, even something as simple as drinking cucumber water. Swelling can be a sign of something serious, so please get checked out by a medical professional. But here's what most doctors won't tell you about water retention, and this is going to sound backwards at first. Your body is actually trying to protect you when it holds onto water. When you're not drinking enough of the right kind of fluids, your body goes into survival mode. It panics and thinks, "We're running low on water. I better hold on to every single drop I can find." It's like your body is preparing for a drought that isn't actually happening. And where does all that water go? Straight to your ankles and feet because of gravity. Your heart has to work hard to pump blood back up from your feet, and when your circulation isn't as strong as it used to be, that fluid just pools down there in your lower legs. Now here's the part that really frustrates people. They think, if I'm retaining too much water, I should drink less water, right? Wrong. That's exactly the opposite of what you should do. When you drink less water, your body holds on to even more fluid because it thinks you're in a crisis. What you need to do is send your body a signal that says, "Hey, relax. We have plenty of fresh water coming in. You can let go of that old, stagnant fluid you've been storing." And that's where cucumber water comes in. Okay, stop what you're doing and listen carefully. I want you to try something right now that will tell you exactly how serious your water retention problem is. Take your thumb and press it firmly into the front of your shin bone, about halfway between your knee and your ankle. Press hard for 5 seconds. I'll wait. 1, 2, 3, 4, 5. Now pull your thumb away and look at that spot. Do you see an indent, a little dent where your thumb was? If that indent stays there for more than 2 seconds, you have what we call pitting edema. That means you're retaining a significant amount of fluid. Now here's the scary part. If that indent stays there for more than 5 seconds, you could be retaining 10, 15, even 20 pounds of water in your tissues. Your heart is working overtime, trying to pump all that extra fluid. Your kidneys are struggling, and every day you ignore this, it gets harder to reverse. But the good news is, you caught it, and what I'm about to share works fast, so keep watching. About 5 years ago, I had a patient named Margaret. She was 72 years old, and her ankles were so swollen she was wearing her husband's shoes. She'd been to 3 different doctors, and they all told her the same thing. Lose weight, take these water pills, elevate your legs. The water pills made her run to the bathroom every 20 minutes. She was miserable. I sat down with Margaret and asked about her daily routine. She told me she was drinking maybe 2 glasses of water a day because she was afraid that drinking more would make the swelling worse. She'd basically stopped drinking fluids altogether, except for her morning coffee. Let me use an analogy that makes this easy to understand. Think of your body like a swimming pool. When a pool gets dirty, you don't drain it completely. You run fresh water through the filter system. The fresh water pushes out the dirty water, and your pool stays crystal clear. Your body works exactly the same way. Your kidneys are the filter. When you drink fresh water with natural minerals, your kidneys say, "Oh, great. We have plenty of fresh fluid coming in. We can let go of this old, stagnant water we've been holding on to." But here's the key. Not all water is created equal. Plain tap water by itself can actually make the problem worse if you drink too much too quickly. Why? Because of something called osmotic balance. Your blood contains a very specific concentration of minerals: sodium, potassium, magnesium. These minerals are critical for your heart to beat, your muscles to contract, your nerves to send signals. When you drink a huge amount of plain water all at once, you temporarily dilute the mineral concentration in your blood. Your body senses this and thinks, "Hold on, our minerals are getting too diluted. We need to hold on to some of this water and balance things out," so it stores that water in your tissues. This is where cucumber water becomes your best friend. Cucumbers are made up of about 95% water, but it's not just any water. That water contains minerals, vitamins, and antioxidants that your body recognizes and can use immediately. Inside a cucumber, you'll find silica, which is critical for connective tissue health. Your skin, your joints, your blood vessel walls all need silica to stay strong and flexible. When you're deficient in silica, your blood vessels become less efficient at moving fluid from your tissues back into your bloodstream. That leads to swelling. Cucumbers also contain potassium, which is absolutely critical for controlling fluid balance. Every single cell in your body has a sodium-potassium pump that controls what goes in and out of the cell. When you have too much sodium and not enough potassium, your cells hold on to water. When you have the right balance, your cells release excess water back into your bloodstream so your kidneys can filter it out. There's also magnesium in cucumbers. Magnesium controls how your blood vessels dilate and contract. When you don't have enough magnesium, your blood vessels get tight, making it harder for fluid to circulate properly. Cucumbers contain caffeic acid, a natural compound with a mild diuretic effect. It gently encourages your body to make more urine without stripping away important minerals like prescription water pills do. Prescription diuretics force your kidneys to dump water and minerals out of your body. That's why people who take them often feel dizzy, weak, or have muscle cramps. Cucumber water is different. It encourages your kidneys to release excess fluid while simultaneously replacing the minerals you need. I told Margaret to try cucumber water for 1 week with very specific instructions. 3 days later, my phone rang. She was almost crying. For the first time in 8 months, she could see her ankle bones. Her shoes fit again. She could walk without feeling like she was carrying weights on her feet. By the end of the week, the swelling was down by about 70%. Not everyone gets results that dramatic or that fast. Some people take a full 2 weeks. Some need to combine cucumber water with other lifestyle changes like reducing salt or moving more. But the majority of my patients who try this consistently see noticeable improvement within 48 to 72 hours. Here's something that might surprise you. The reason cucumber water works better than plain water is because of osmotic balance. Your blood vessels are like tiny tubes with walls that act as filters. Water and small molecules can pass through those walls, but larger molecules stay inside. The problem happens when the balance between fluid inside your blood vessels and fluid outside in your tissues gets out of whack. When you drink plain water, you're dumping pure H2O into your bloodstream. That temporarily dilutes everything in your blood. Your body activates a hormone called ADH, which tells your kidneys to hold onto water. Meanwhile, some of that extra water leaks out of your blood vessels into your tissues. So you're drinking water, but you're still swollen because your body is confused. When you drink cucumber water, you're giving your body water plus minerals. The minerals match the composition in your blood much better than plain water does. Your kidneys recognize they have good quality fluid to work with, so they start filtering efficiently. They remove the old, stagnant fluid that's been sitting in your tissues. There's another factor here. Cucumbers contain natural antioxidants and anti-inflammatory compounds. Chronic low-level inflammation is one of the hidden causes of water retention in older adults. When your tissues are inflamed, they become leaky. Fluid escapes from your blood vessels into surrounding tissue and gets trapped there. The antioxidants in cucumbers help reduce that inflammation and strengthen blood vessel walls. Now, listen carefully because this is critical. You cannot just drink cucumber water once and expect a miracle. Your body needs consistency. You need to drink this throughout the day, every day, for at least 2 days to start seeing results. Here's the mistake everyone makes. They make a big pitcher, drink a huge glass in the morning, then forget about it. That doesn't work. Your body needs a steady, consistent supply throughout the day. When you drink a huge amount all at once, your kidneys can only filter about 1 liter of water per hour. The excess just sits in your stomach without giving your body the mineral benefits. What you need to do is sip cucumber water steadily from morning until evening. Set a timer on your phone to go off every 2 hours. When that timer goes off, drink 1 full 8-ounce glass. Do this from the time you wake up until about 2 hours before bedtime. You don't want to drink a lot right before bed or you'll be up all night. Keep your cucumber water cold. Not ice cold, but nicely chilled. When water is cold, you're more likely to drink it. Cold water also helps improve circulation because it causes your blood vessels to briefly contract and then dilate, creating a pumping action that helps move fluid out of your tissues. And you need to keep doing this even after the swelling goes down. I've had patients who got amazing results in 3 or 4 days, then stopped. Within a week, the swelling came back because they went back to their old habits. Let me tell you what my patients report after drinking cucumber water daily for just 2 days. First, their rings start to fit again. That's usually the very first sign, within 24 to 36 hours. Then their ankles start to look more defined instead of puffy. They can see where their ankle bone is, see the tendons on top of their foot. Their shoes feel comfortable again. Being able to wear nice shoes again, to go out without feeling self-conscious, that's life-changing. Many tell me they can see their ankle bones for the first time in months. One patient actually cried when she looked down and saw her ankle bone because she'd forgotten what it looked like. But it's not just about appearance. Their legs feel lighter. That heavy, waterlogged feeling goes away. They can walk further without that tired, achy feeling in their calves. Some tell me they're able to go shopping again, take walks with their spouse, play with their grandchildren without having to sit down every 5 minutes. Some even notice they're getting up less at night to use the bathroom. When you're not hydrating properly during the day, your body tries to catch up at night. But when you drink cucumber water consistently throughout the day, your kidneys do their job during waking hours instead of waiting until you're trying to sleep. Here's a bonus benefit. Cucumbers contain powerful antioxidants that help reduce inflammation throughout your entire body. Several patients have told me their arthritis pain improved after a couple of weeks. Cucumbers also contain compounds that may help protect against cognitive decline. And people report better skin hydration. When you're chronically dehydrated, your skin gets dry and papery. When you start hydrating properly, your skin plumps up. Fine lines look less noticeable. People tell me they just feel better overall. More energy, better digestion, better mood because they're not dealing with constant discomfort. Sometimes the simplest remedies have the most far-reaching effects. But I have to warn you about something really important. If you have kidney disease, especially stage 3, 4, or 5 chronic kidney disease, do not start drinking large amounts of any fluid without talking to your nephrologist first. When your kidneys are damaged, they can't handle sudden changes in fluid intake. Drinking too much too fast can cause dangerous fluid overload and heart failure. The same warning applies if you have heart failure. When your heart isn't pumping efficiently, your body can't handle excess fluid. Drinking a lot of cucumber water can cause fluid to back up into your lungs. That's called pulmonary edema, and it's extremely dangerous. If you're taking prescription diuretics for high blood pressure or any other reason, be very careful. Cucumbers have a natural mild diuretic effect. If you combine that with your prescription medication, you could lose too much fluid and too many minerals, especially potassium. Low potassium can cause dangerous heart rhythm problems. Talk to your doctor first. If your swelling is only on one leg, or if it's painful, red, and warm to the touch, do not try to treat that at home. That could be a blood clot, deep vein thrombosis. Blood clots can break loose and travel to your lungs, causing a pulmonary embolism, which can be fatal. Get to an emergency room immediately. If your swelling came on suddenly with shortness of breath, chest pain, or extreme fatigue, that's also a medical emergency. Those could be signs of heart failure, kidney failure, or liver problems. Get medical attention right away. If you're taking blood thinners like warfarin, cucumbers contain a small amount of vitamin K, which can interfere with how those medications work. Let your doctor know so they can monitor your blood levels. Some people are allergic to cucumbers. If you develop itching, hives, swelling of your lips or tongue, or difficulty breathing, stop immediately and seek medical help. I'm giving you these warnings not to scare you away, but because I want you to be safe. For the vast majority of healthy older adults with mild to moderate water retention, cucumber water is extremely safe and effective. But if you have any of the conditions I mentioned, you need medical supervision. All right, let me give you the exact recipe and protocol. Here's what you need. 1 medium cucumber, about 7 to 9 inches long. 8 cups of filtered water, about 2 liters. A large glass pitcher with a lid. Take your cucumber and wash it thoroughly under cold running water. You can peel it if you want, but I recommend leaving the peel on. The peel contains extra fiber, antioxidants, and silica. The nutrients are concentrated in and just under the skin. Only peel it if the cucumber has a thick, waxy coating. Slice the cucumber into thin rounds, about a 1/4 inch thick. Thin slices have more surface area, so more nutrients will infuse into the water. You should get about 30 to 40 slices from 1 medium cucumber. Put all the cucumber slices into your pitcher. Add the 8 cups of filtered water. Give it a gentle stir to make sure all the slices are submerged. Now, here's the part most people get wrong. You have to let it sit. Do not drink it right away. Put the lid on and place it in your refrigerator for at least 2 hours. This gives the cucumber time to release its minerals and beneficial compounds. I actually recommend letting it sit overnight. The water will take on a light greenish tint and a mild, refreshing cucumber flavor. Here's your daily protocol. Pour yourself a glass first thing in the morning, even before breakfast. Drink 1 full 8-ounce glass. Then set a timer on your phone to go off every 2 hours. When that timer goes off, drink another 8-ounce glass. Your goal is to finish that entire 2-liter pitcher by bedtime. That's about 6 to 8 glasses spread throughout the day. Can you reuse the cucumber slices? Yes, but only once. After you've finished your first pitcher, you can add fresh water to the same slices and let it infuse again. Let it sit for at least 4 hours or overnight. After the second batch, throw those slices away and start with fresh ones. If you want to boost the effect, add 4 or 5 slices of fresh lemon. Lemon adds vitamin C and more potassium, plus a nice bright flavor. You can also add a handful of fresh mint leaves, about 5 or 6 leaves. Mint aids digestion and makes the water taste more refreshing. Some patients like to add a few slices of fresh ginger for its anti-inflammatory properties. But the cucumber is doing the heavy lifting. Keep your cucumber water ice cold. Add ice cubes to your glass when you drink it. When it's really cold, it's more satisfying, and you'll look forward to drinking it. Here's what a typical day should look like. Wake up at 7 in the morning, drink your first 8-ounce glass before coffee or breakfast. Around 9 o'clock, drink your second glass. At 11 o'clock, third glass. At 1 in the afternoon, fourth glass. At 3 o'clock, fifth glass. At 5 o'clock, sixth glass. Maybe one more at 7 o'clock. That's 7 glasses, about the full 2-liter pitcher. Stop drinking large amounts about 2 hours before bed. If you need to leave your house, get an insulated water bottle that keeps drinks cold for hours. Fill it with your cucumber water and take it with you. Sip on it throughout the day so you can stick to your protocol even when you're out. How long should you do this? At minimum, commit to 2 full days before you evaluate whether it's working. Most people need a full week to see maximum results, but once your swelling goes down, don't stop. Make cucumber water a permanent daily habit. It's not a one-time thing. It's daily maintenance for your health. If after a week you're not seeing any improvement, dig deeper with your doctor. There might be an underlying medical issue that needs medication or other treatments. Cucumber water is extremely effective for mild to moderate water retention caused by dehydration, excess salt, or sitting too much. But if your swelling is caused by kidney disease, heart failure, or another serious condition, you'll need more than cucumber water. Water retention in your legs and ankles is not just a normal part of aging you have to accept. In many cases, it's a sign your body is dehydrated and confused about managing fluids. The solution isn't to drink less water, it's to drink more of the right kind of water. Cucumber water works because it provides hydration with essential minerals like potassium, magnesium, and silica. It has a gentle natural diuretic effect that encourages your kidneys to release stored fluid without stripping away nutrients. It reduces inflammation throughout your body, and it's completely safe for most people when used correctly. The key is consistency. Drink cucumber water throughout the day, every day, for at least 2 days to start seeing results. Set timers. Make it a habit. Keep a pitcher in your fridge at all times. But be smart. If you have kidney disease, heart failure, or you're on prescription diuretics, talk to your doctor first. If your swelling is severe, sudden, painful, or only in one leg, get medical help immediately. Remember, swelling is your body sending you a message. Don't ignore it, but don't panic. Start with this simple cucumber water protocol. Give it 2 full days of consistent drinking. Pay attention to how your body responds. Take photos of your ankles on day 1 and again on day 3 so you can see the difference. If this video helped you, I'd love to hear about your results in the comments below. Tell me how many days it took for you to notice a difference. Share your story because your experience might inspire someone else struggling with the same problem. And if you know someone over 60 who deals with swollen ankles, who's been told there's nothing they can do except take water pills, please share this video with them. Sometimes the simplest solutions are the most powerful. Sometimes the answer isn't in a prescription bottle. Sometimes it's sitting right there in your refrigerator. I'm Dr. Sandra Serrati, and my mission is to help you live a healthier, more comfortable life, using simple, natural approaches that actually work. Thank you for watching, and I'll see you in the next video.